Hello, so my name's Irene Higginson, and it's a real pleasure to be here today because breathlessness is one of the... Yeah, that's working. It's a real pleasure to be here today because breathlessness is one of the symptoms that I've been very interested for a long period of time. And at the Cicely Saunders Institute, in a way, it's been very interesting to start working on breathlessness because we bring together palliative care and rehabilitation. So we're interested in that interface between the two things. So I was asked to talk about the patient perspective, and so I just really had three objectives for this session. One was to try and convey to you a broader understanding of what it's like to be breathless. And I'm using from this video evidence from patients who have chronic breathlessness, which they've given their consent for, which they did as part of the work that we did with the Breathlessness Support Service, and also some empirical research that we did looking at qualitative and quantitative views. I'm in a way convey to you the different components of breathlessness and how they interact so that you can then use this information. And in a way, Noel's talked eloquently about why breathlessness, because it's hugely common. I've given you more or less the consensus definition of it here, which is that it's a subjective experience encompassing multiple factors. And obviously it has direct implications on patients, carers, causes high use of health services, including hospital admission. So I'd like you to reflect for a minute on what you did last time you got breathless. And I would say that one of the things to remember about breathlessness is it's a funny symptom because actually getting a bit breathless is normal. And one of the things that we learned in doing the Breathlessness Support Service is getting some breathlessness is actually not a bad thing, because if you do no breathlessness at all, you're not taking enough activity. However, patients use terms when it becomes what we would call a breathlessness that's not responding to the disease or treatment, or they feel unable to recover from the breathlessness. They use terms like dreadful, worst thing ever, struggling to catch a breath, suffocating. So one of the other problems that we found in the work is how people present to the doctors. So this is quite an interesting story of somebody who has found that breathlessness has affected their life but doesn't feel able to present with that problem to health services, which chimes very much with what Noel was saying about the difficulty in detection. And this quote here, which you can read, can you see the text all right around? There's various slides around the room. And so, I mean, this is somebody who turns up to the doctor all feeling very sad and miserable, and the doctor says, oh yeah, you're here in good form, and of course because they've taken a car there, they're not short of breath, but as soon as they leave and they start walking up the hill, they realise that they are short of breath. And this is another nice example of somebody taking kind of control themselves, in that they get their children to buy them a nebulizer for their birthday, which helps them at home. And helps them get around. The other thing to flag is that when people have chronic or progressive disease and breathlessness, they have loads of other symptoms as well. So some work that we did shows that on average, people who have breathlessness have on average 13 or 14 symptoms, which include pain, appetite problems or obesity, constipation, etc. And they also have higher levels of anxiety and depression. So if you see someone with breathlessness, you see this pattern of things. So I guess just to finish, because we have a short time, the take-home messages that I'd give is that breathlessness is highly prevalent. The experience is frightening, isolating, it can fluctuate markedly, and people feel that they've lost control, and the fear is quite important. And I'd like to stress the isolation and the invisibility as well. People can't talk, they lose their social contacts, they lose going out, and they do get into what Noel described as this sort of cycle of increasing deterioration and disability. Their muscles get weaker, they get more breathless. You know, if you go to the gym or if you're running for the bus, if your muscles are weak, you get short of breath. It's the same situation for anyone. There's a whole emotional package, you're going to hear more about that, which is related to panic, depression, anxiety, and loss of confidence. They lose their functional roles, so they're not able to do even sometimes basic things at home, which has quite a big impact on caregivers and family members as well, which is worth considering. And then they get this, as the First Lady demonstrated, this feeling of worthlessness, I'm of no value, I'm hopeless, and so on, and a loss of will to live. And the smoking thing is very interesting. So the number of people that I've met, and they're asked if they smoke repeatedly, and some of them haven't, but they feel that there's this stigma about it. And of course there is a stigma, and the people who have smoked feel guilty because it's self-inflicted, and the people who have never smoked but have got breathlessness actually have this sort of stigma. Why am I always being asked if I smoked? I've never smoked, and yet I've got this. And then people do or can try and take control to try and reverse this cycle of deterioration. And so one of our challenges, I think, and why I think this initiative is so exciting, is to try and support this. And that I was focusing on the experience, but at least give you the feeling that we shouldn't be nihilistic about this. Things actually can be changed. There are some simple things like the handheld fan, which actually for people with quite severe breathlessness do have a little evidence base. I'd just like to acknowledge my colleagues, and that's all. Thank you very much for your attention. Thank you for caring about breathlessness, even more importantly.